Hello, and welcome to How to Use ALS Untangled. In this video, I will explain the purpose of ALS Untangled, how we get the topics for our reviews, how we evaluate the topics, how you can interpret our reviews, and how you can submit and vote on topics to be reviewed. It is my hope that this will make ALS Untangled more clear to you and help you to participate in our program. ALS Untangled is here to help you make better sense of alternative treatment options advertised on the internet. Patients with ALS often consider alternative or off-label treatments they read about on the internet. Internet information about alternative treatments is not always accurate or easy to interpret. In 2009, the North American ALS Research Group started ALS Untangled to scientifically review alternative treatments and help patients and families make more informed decisions about them. There are 3 parts to ALS Untangled: getting ideas for reviews, conducting the reviews, and getting our reviews out to patients and families. We get ideas for reviews from you, the ALS community. You can send us ideas for reviews in several different ways. You can email Dr. Bedlack or Facebook message him. You can ask your doctor to contact Dr. Bedlack with your idea. Most commonly, ideas are sent via Twitter. You have to have a Twitter account to use Twitter, but signing up for this is free and it's easy. Once you have a Twitter account, all you have to do is send a message that has the word ALS Untangled in it, and we will find it. We get quite a few ideas for reviews, and so we have to prioritize them in some way. We ask patients and families to vote for the reviews they most want to see, and then we try to focus on the reviews that have the most votes. Voting is easy and it's free. All you have to do is click the vote button next to the treatment you're interested in, and it will move up the list. We have a standard protocol by which we conduct our reviews. This starts with attempts to contact the proponents of the alternative treatment. Materials used to advertise the alternative treatment are gathered to determine what claims are being made about it. A PubMed search is conducted to determine if there are relevant scientific publications. A Google search is conducted to review any related news items or blogs. The ALS Untangled review team is polled to see if any patients under their care have tried the alternative treatment and what happened to them. The PROACT database and Patients Like Me are queried, and if patients trying the alternative treatment are identified, their available outcome measures before and after the alternative treatment are reported. Attempts are made to visit the clinic offering the alternative treatment to review its infrastructure, oversight and consent processes, interview patients who are trying it, and review medical charts on the clinic's best successes. Once we have all this data gathered, we use it to complete something called the Table of Evidence for the review. There are 5 categories in the Table of Evidence: mechanism, preclinical data, anecdotal data, trials, and risks. We give every alternative treatment a letter grade in each of these 5 categories: A, B, C, D, F, or U. Specific cutoffs for achieving each of these have been developed and are available on our website. Finally, an ALS Untangled team member writes a first draft of the review, and the entire team of 100 clinicians and scientists from across 10 different countries provides edits via email. When the team is satisfied, the review is submitted to the journal called Amyotrophic Lateral Sclerosis and Frontal Temporal Degeneration, and if approved by the editor, it is published. Our reports are open access, meaning they are freely available to all. You can read any of our reviews by clicking on the name of the alternative treatment on our completed reviews page. So, to summarize, ALS Untangled helps patients and families review alternative and off-label treatments for ALS. If you find an alternative treatment you want to know more about, first check our completed reviews page. If we have already reviewed this, you can see the letter grades for each of the categories in the table of evidence, and you can read the article by clicking on the name of the treatment. If your idea has not yet been reviewed, see if it is already on our list for a future review by looking under the Open Reviews page. If your idea is on there, be sure to vote for it so it moves toward the top of our priority list. If your idea is not on either the completed reviews or open reviews pages, submit it to us by email or through your own doctor or through our Twitter feed. That's all there is to it. We hope you will find this program useful in making more informed decisions about your ALS care.
I got the locked in blues. I got the locked in blues. I got the locked in blues. I got the locked in